coming up, it's going to be the Pulse QEH radio show. Brought to you the compliments of MedSafe Medical Supplies Limited. For all your medical supply needs, visit MedSafe Medical Supplies Limited. They offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the QEH. And for your convenience, they deliver free to the Queen Elizabeth Hospital. They're open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Give them a call at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials. All right, let's get the show rolling for another Monday. Shane, good morning.
A pleasant good morning to you, Andre, and good morning to all of our listeners right here on the Pulse radio show. This is our 6th episode, so we're really into it. The Queen Elizabeth Hospital. This is a part of our outreach to you, the public, so that you can know about your hospital and how best to utilize its services and how to reach out to us. And there are a number of ways to do that. Of course, there's the telephone lines, but we have a number of other avenues, especially online, and I want to encourage you to use our www.qehconnect.com portal. That is where you can get all of the information you may need. You can make your complaints, you can send in your compliments, you could just go on the various landings or tiles there on the website, click the link and do just that. And also for episodes of the Pulse radio show, we have our podcast, so you can go right there on our website and you click the Pulse, you will see the latest episode, and once you click that as well, you will see some of the other episodes there available for you on our website. Just click the link, the Pulse, and we'll be telling you a bit more on how you can keep connected with us at the Queen Elizabeth Hospital. I'm Shane Seeley, communications specialist, and with me co-hosting this week's show is our Director of Medical Services, Mr. Tony Harris. He is a doctor by profession, and you will never hear me refer to him as Dr. Tony Harris. He is Mr. Tony Harris, and I always ask him, you're our new host, my co-pilot on this edition, the 6th episode of the Pulse Radio Show. Mr. Harris, welcome.
Thank you very much, Shane.
And you will have to explain why I call you Mr. I know I always tell you that, but for those of our listening audience who are listening to Q100.7 FM, the Pulse Radio Show here on CBC Radio, explain to them why I call you Mr. Harris instead of Dr. Harris.
Well, it's a long story. I have been Mr. Doctor, back and forth. But basically, the Mr. designation is when you are a qualified surgeon with the British Royal Colleges. I'm a fellow of the Royal College of Edinburgh. That's where I did my general surgery first. So after that, of course, you are designated a Mr. And as you point out, certainly not in Barbados, but certainly in the British Isles, if you mistakenly refer to a qualified surgeon as a doctor, you would definitely provoke their ire, and they would be deeply offended, and you will definitely know that that's something you should not do. But as I said, I did my cardiothoracic surgery afterwards in New York, so I had reverted back to doctor, and therefore I can accept any designation that you put to me. I would wear all the hats, but traditionally in Barbados we are called Mr. when we are qualified in the British system as surgeons.
So we're sticking with tradition today, Mr. Harris, and I will continue to do that in my role as communications specialist. Today we are focusing on QEH cardiac care services, and we're partnering with you for heart health. And we'll be welcoming another specialist very shortly onto the show, Dr. Dawn Scantlebury, and she'll be able to tell you about herself. She is a noted cardiac specialist, and maybe you can speak a bit about her as well and that working relationship, because as Director of Medical Services at the hospital, you're directly responsible for all of the medical directorates.
Yes. Well, and certainly we are very proud of Dawn. Dawn is a graduate of the UWI. She did her general medicine training with UWI, being qualified as a doctor of medicine from the UWI. Then she went off to very hollow places in the world. She was I think she first went to Kentucky, and then she went to the Mayo Clinic to do interventional cardiology. So she's really one of our very well trained, very well qualified cardiac specialists at the hospital, or interventional cardiologist. She is now currently the head of the Department of Cardiovascular Services, and we're all very proud of Dawn, and she really does champion, not just even in Barbados. Dawn really is a champion of cardiac care, cardiac standards right across the Caribbean, and she works very well and do a very good job for us.
Indeed. And we have a wide range of cardiac specialties and cardiac services available at the Queen Elizabeth Hospital, and you'll be hearing a lot more about them as the show goes on this morning. Just a reminder for you listeners, the numbers to call when you have your questions: 434-1007, 434-1070, and you can also send in your WhatsApps. You've been doing that at 434-1007. And last week we were able to respond to a caller who had a question about not being able to get through to our medication delivery service. And I'm happy to say that we reached out to that caller. We got the number through the WhatsApp. We reached out and we were able to get that issue sorted. So it's all about what our CEO, Mr. Neil Clark, said last week. We can only respond to those challenges, especially individual challenges, if we hear from you, our callers and listeners, about the challenges you have in interfacing with the QEH. So keep those WhatsApps coming, keep those things coming, and we will be able to respond when you have your concerns or challenges, any problems you have in reaching out to us at the Queen Elizabeth Hospital. We will be able to address that through our Pulse radio show as we connect with you, our public, our listeners, our patients, visitors, and of course those well-wishers of the Queen Elizabeth Hospital. So on the phone line we have Dr. Dawn Scantlebury, and I want to say a pleasant good morning and welcome to Dr. Scantlebury as a part of the program. Good morning, Dr. Scantlebury. How are you doing? Oh, we have a regular caller already. We will get Dr. Scantlebury on the line shortly. So let's go to the phone lines already. We have the callers coming in. Good morning. Welcome to the Pulse Radio Show. How can we assist?
Good morning.
Hi, pleasant good morning.
Good morning.
Yes, I'm a senior surgeon. I was at the hospital, the accident and emergent C-section last week, and I was waiting till the patient delivered to the ward, and it was after midnight, and when I came down, the guard directed me through the glass to go out. So when I realized I was out, I went to the security guard, and I asked him if I can get a taxi, which I gave him a taxi number that I can call, but I could not get through to the taxi. I said, are there not taxi that you all have here that I can reach to get home? He said he don't know of anyone. I have to stay outside because I would not be allowed back in. I said the patient have been just delivered to the the ward, and there's no way I can get home. So I was outside. He said, you will have to stay there on the break there. And I was there. But a pleasant security guard came and asked, why am I doing out there? I said, I'm not allowed back in. So he said, well, try and get back in and find a chair. I don't know. Probably I would be the next casualty if I had to stay there until 5 o'clock, which is very unfair. Because, I mean, people coming from the casualty and they're going outside and getting coffee. I just came from inside. Why was I not allowed to go back in?
Could be a number of reasons. I'm aware that, I think the public will be aware that recently we had a surge in gun-related crimes, and a number of those cases ended up in the accident and emergency department for treatment. And I can tell you, on those situations, especially during those times, normally we issue shutdowns of the department.
Yeah, because I was there with one of the shutdowns during the day. But so I'm saying that I could go through security again. He could verify the patient is there that have been just admitted and allow me in. You know, my life would be actually in jeopardy there.
Right. So let me say this to you: your life, you're secure on the QEH premises, especially now
You mean outside sitting down?
Even outside sitting down. And let me explain to you why. We've just entered what is a new arrangement with the Barbados Police Service. They've enhanced and increased patrols across the campus. I'm talking about the entire campus of the Queen Elizabeth Hospital, to ensure that the public can feel confident and safe, along and complemented by our security team, while you are in that space, in the confines of the hospital and in the immediate environment. So I'm saying to you that the QEH and our immediate surroundings is a lot more secure now, especially now that we have that enhanced partnership. We always work alongside the Barbados Police Service, but they have agreed to not only help our security do what they do a bit better, but also they have enhanced their security presence around the campus, so that patients, staff, and definitely visitors like yourself on that occasion can feel safe traversing the hospital.
Yeah, but seeing that it was after midnight, you know, and the other security guard was concerned with me being outside. You know, I must say thanks to him, because I don't know what, as I said, what would have happened.
And it might be a difference in the time period too. So it's good that you had that experience with the second security guard who would have been able to advise you about what was going on at the point in time. I really hope he did. And also, yeah, we do have hospital taxis, but I think what happens, there are numbers that are listed as well there for those hospital taxis, but I know at those later hours you tend to get fewer taxis to accommodate patients who may want them. So then more people would call I will always tell anyone, you can Google taxi services on your phone and see what's available, and give them a call, and they're not too far away from the hospital. They'll definitely come to assist you.
Yeah,
but in that case, we do apologize for that initial response you got, but it's good that the secondary response complemented that, and that you were able. The fact that you're talking to us here today means that you got home safely.
Yeah.
And I hope that your family member or friend in that instance, that they're recovering well. I really hope so.
Yeah. Thank you very much.
You're welcome, and thank you for calling. As I said, it's only when we hear these concerns and challenges that we are able to respond to your concerns. I think we have another caller. Okay. Right. So speaking about the cardiac, and I know we are getting Dr. Scantlebury on the line. Speaking about cardiac care, I know that we've been seeing NCDs, and that is a part of what we see, and it's a part of the NCD spectrum. We've been seeing so many more patients, so many more individuals coming through the doors of the QEH to seek help for cardiac issues.
Sure, Shane. The NCDs are the primary risk factors for heart disease. Hypertension and diabetes both have the load of cardiac complications. So with the rising number, or the apparent rising number of NCDs, we are expecting that we would have a rise in the heart disease. It always brings to mind how things have evolved over time. Certainly when Dr. Richie Haynes, as the public would know him, opened the medical ICU back in 1971, prior to that there was not much in the way of heart attacks, and they would see perhaps a heart attack in over one every week plus. Nowadays, we know that people presenting to the accident and emergency with heart attacks have really risen in number.
Exponentially so.
Yes, we are seeing it rise. It is more than one, certainly more than two a day of heart attacks that we will see. So that is the evolution of the scene over these last 50 plus years and stuff, as we have as we start out. When the hospital, and this is the 60th anniversary for the hospital this year, when it started out, the main thrust back in those days was certainly the infectious diseases and things like that. There was a TB ward, there was a gastrointestinal ward for children, and it is amazing how both of those wards have now evolved to be intensive care wards for things like heart attack, stroke, and other sophisticated diseases that all result from the NCDs. And we know that the hospital is always on there's certainly a big demand for critical care beds to take care of these kind of conditions. So it is something that has changed. The face is changing as we go along, and we know that we are going to be seeing more and more in the future.
Indeed. We want to get on top of the situation, and that's the aim, to really ensure that we are responding to the needs of the population.
Sure.
You've said that we are seeing, coming from seeing them once a week in the 1970s to now seeing 2 on a daily basis.
Or more.
And
then, of course, that's just heart disease. That doesn't even talk about stroke. And stroke in our population is probably even more prevalent than heart attacks and stuff like that. So it is something that we have to grapple with. And of course, the other thing is that you get kidney failure and stuff from the NCD, hypertensions, diabetes, and that is rising also at a phenomenal rate. So what was able to have 4 chairs or so back in the 70s and 80s to take care of our patients with renal disease, we now have an explosion of complications from the NCDs in the renal sphere, ensuring that we would need to every day dialyze, more than 20 patients every day. So we are seeing a lot. And
we are seeing a number of younger people coming to the hospital seeking care as well. Let's talk a bit more about the trends now that we have Dr. Scantlebury on the line. Dr. Don Scantlebury, a cardiac specialist at the Queen Elizabeth Hospital. Dr. Scantlebury, great to chat with you here on the Pulse Radio Show. Welcome.
Thank you.
A pleasant good.
You hear me well?
Very well.
I'm hearing you well. Hearing you pretty well, and I know our listeners will need to hear you well today because so many people are coming through your doors, the Department of Cardiovascular Services, for help with some cardiac condition. Set the scene for us and talk about the trends as it relates to cardiac care in Barbados. But first, before I get to that, sorry to be a bit all about the place, Mr. Harris was speaking about you and your accolades in medicine. I really would like, I always say this, I would really like you to tell the public a bit about yourself. Who is Dr. Dawn Cantlebury, cardiac specialist?
I am a cardiologist, an interventional cardiologist, consultant at the hospital. I'm head of the Department of Cardiovascular Services. I also wear a lot of hats otherwise. I am a first vice president of the Heart and Stroke Foundation of Barbados and medical director of the Cardiovascular Disease Prevention and Rehabilitation Program. I'm a senior associate lecturer in cardiology at University of West Indies. I am on council of the Caribbean Cardiac Society, and then I also I'm on a few committees of international societies, in the U.S. and etc. So we do a lot, and that is not unusual for our cardiac specialists here in Barbados, because there are so few of us. We end up having to stretch ourselves kind of thin trying to get everything done.
I was going to say the population is very happy that you do, especially with the current trends in our society. And I would really like you to speak to that, Mr. Harris, set the scene a bit, but to talk a bit about what you're seeing coming to the hospital, coming through your department.
Okay, so cardiovascular disease, sorry, I didn't hear everything Mr. Harris was saying. I tried to log in when you all were trying to get me on the phone, but I'll just take a step back and describe what we're talking about. Cardiovascular disease is essentially heart and blood vessel disease. So the kinds of heart diseases that we see are myriad. They range from coronary disease. So the coronaries are the blood vessels that supply the muscle of the heart. So if you have disease related to the coronaries, you can come in with a heart attack. You could have angina, which is chest pain on exertion. You could come in with heart failure. Heart failure is another big condition that we see. It's one of the most common causes of hospital admissions, hospital readmissions. That's when you have muscle damage or muscle problems, heart muscle problems. So patients may have shortness of breath on exertion, fluid retention, leg swelling, that kind of thing. It's a very common cause of hospital admission. Abnormal heart rhythms, atrial fibrillation, ventricular tachycardia, those are some of the things that we see. Sudden cardiac death sounds like a little misnomer, because if you're dead, but not really. If you happen to be resuscitated and admitted, then your diagnosis was resuscitated cardiac death. That's another presentation, and that's how a lot of heart attacks may present as well. So back in the 70s and 80s, and 70s, when cardiology was in its infancy in Barbados and the cardiac unit was first established by Sir Trevor Hassel, the predominant cardiovascular disease that we were seeing was rheumatic heart disease. It was related to infections, and it was fairly common, but not that common. We did not have that degree of burden. Heart attacks were few and far between, and those were for the visitors. Now, what we're seeing more than a heart attack a day. Either patients dying suddenly at home or coming in with sudden chest pain, etc. And coronary disease, which was again unheard of back in the 70s and 80s, is exceedingly common. And some of that relates to the change in our lifestyle in Barbados. The changing from a predominantly agricultural type society. People were more physically active. They ate closer to the earth. Now to our heavy trend of urbanization, everybody has a vehicle. There's very little public transportation, and there's a lot of fast food. So really and truly, when you think of cardiovascular disease and heart attacks, a lot of people think that it's not their problem because it's a problem of old people, but it's not. It is. We see people from early on, pediatric age, yes, but the age at which people are developing heart disease, heart attacks, heart failure is dropping, and you can see it in men, you can see it in women, you can see it in young mothers. You see it in everybody. It is the number one cause of hospital admission, number one cause of death in Barbados.
And it's alarming, especially when you speak about the number of younger people, and I'm thinking people in their early 40s, probably late 30s, now presenting to the hospital for admission with cardiac issues. And some of those factors that you spoke to just now, less physical activity, we're less physically active generally as a population. We need to get out more, we need to exercise more, we need to eat better. How much of this re-education or education to begin with do you have to do, especially when younger persons or persons of any age come through your doors for assistance with cardiac problems? And is it a situation where that there can be a complete reversal, or is it medication for life?
We have to do a lot of education. It's a daily thing. Everyone that I see, there is some discussion on physical activity. There's a discussion on diet, even if it's the diet that they need to avoid to avoid worsening of their condition. So like the heart failure patient really needs to avoid excessive salt, otherwise they come in with fluid retention. The person who has just had a heart attack, we need to talk about what kind of lifestyle you need to lead to reduce your risk of this happening again. If you have a heart attack, you have a scar on your heart. If you've had a heart attack, I should say, you've had a scar on your heart, and there are certain medications that we use to reduce the effects of the scar on the heart, on your overall well-being. And we also have your medication to prevent recurrence. But the foundation of management of those risk factors, and those risk factors are things like diabetes and hypertension and high cholesterol, the foundation of management still remains that lifestyle. So I often tell patients that you need to go back to the earth as far as healthy eating, more plant-based. There's this famous saying, eat food, real food. So real food meaning the food that came out of the earth and you put on the stove to cook. Mostly plants and not too much. So if you think of it that way, mostly plants, not too much of it, and eat real food and not the heavily processed stuff, you can help us a lot as far as management of that cholesterol, as far as management of that your diabetes, as far as management of your hypertension, and you could actually help reduce your pill burden, meaning the amount of tablets you're taking, by really taking your health into your hands and back into your control. Very often you are going to end up being on some medication for life, but the amount of medications you need to be on can be limited by a very aggressive approach to your lifestyle. Aggressive meaning healthy approach to your lifestyle.
Okay, we'll take a quick pause here for a cause. We also have to go to the phone lines. We have callers waiting, but we'll take this quick commercial break and be right back with more on the Pulse Radio Show. I'm Shane Seeley, and with me is Mr. Anthony Harris. He is a cardiothoracic surgeon.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. They offer a wide range of products, including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, they deliver free to the QEH. They're open Monday to Saturday, 8:30 a.m. to 5:30 p.m. You can give them a call at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials. And now the QEH Pulse Radio Show continues.
Thank you so much, Andre. Back with you on the Pulse Radio Show. Shane Seeley here with Mr. Tony Harris, who is also our Director of Medical Services. And we also have Dr. Dawn Scantlebury. She is the head of department for cardiac care at the QEH. Let's go back to the phone lines. We have another caller. Good morning, caller. Welcome to the Pulse Radio Show. What's your question or comment?
Good morning.
Good morning.
Hey, good morning to the doctors and producers. I have an issue I'm not. It's not related to cardiology, but I've been having dizzy headache, a dizzy feeling in my head for a little while. I was allocated to see a neurologist. But I think when it was giving me letter, he was getting ready to retire. But I realized that every time I get an appointment, the same day before I get to the hospital, I get a call, and it's cancelled. The last one was like 2 months ago, and it got cancelled. And the person told me that I asked them if they want me to come back and renew the appointment myself, or they said they would call me. But I haven't got a call, and I don't know really what's going on because I'm getting worse. Unfortunately, I don't have the funds that I could get the procedure done on the outside. What do I do in this situation? How can I go forward? Especially my whole feeling. What do I do?
Sorry to hear your problem, sir. But coming out of COVID, what we did was establish a help desk at the Queen Elizabeth Hospital. I don't know if Shane, you can remember the number that you can advise this patient.
Definitely.
But basically,
after you finish your response, I'll give you that number.
But basically, what you need to do is just to call them and get them to assist you in getting back into the stream. We are still having little kinks of getting the appointment smoothed out as best as possible, but I am sure we can do that for you. We have a new neurologist, Dr. Jacinto, who took over from Dr. Corbin, who I believe you're referring to as
please.
retiring. And it's just a matter of getting you back into the system. So I think Shane can help you with the help desk number, and they will give you the assistance that you're seeking.
Yes, and that number is 536-4800. 4800.
4800.
Yes, you can call that number.
Yes, please.
And we have our medical team manning the help desk. It's called our Patient Advice and Liaison Service. You call and you give them the information, and they'll be able to direct you and get you in the system so that you can get that help that you need. And they'll also be able to advise you if you're feeling a bit worse. You spoke about your dizziness that you're having. They may be able to direct you if it is an emergency to the accident and emergency department. If you need an ambulance, they can get that for you as well. So you can get whatever you need in terms of getting that feedback about your condition. You can tell them how you're feeling, and they can basically give you some analysis, some prescription about how you could manage the condition, right, Ms. Harris?
Yes.
Okay, thank you very much. I do appreciate this.
Yes, not a problem.
Absolutely no
Guys, have a
problem.
good day, man.
You too.
Thanks.
You as well. You're listening to the Pulse Radio Show. We have Dr. Scantlebury, our cardiac specialist, on the line. She's also the head of the Department of Cardiovascular Services, consultant with the QEH. Dr. Scantlebury, there are a number of services offered in your department. Can you just give us an overview of those services?
Sure. Our department is divided up into for non-invasive cardiology, invasive cardiology, and cardiac surgery. So cardiac surgery, as we say, is self-explanatory. Our surgeons, who are Dr. Cressida Paulette and Dr. Alan Smith, they do bypass surgery, they do valve surgery, any surgery related to the heart, except perhaps heart transplant, are done. Patients are referred via the cardiologist. We have 4 adult cardiologists and 1 pediatric cardiologist in the department. The non-invasive cardiology area is where we do our outpatient clinics, and there are quite a few of them, and we do cardiac testing. That ranges from electrocardiograms, ECGs, echocardiograms, Holter monitors, which are 24-hour ECG rhythm monitoring, stress testing, stress echocardiography. Most of those tests are referred through some clinic within the hospital, either clinic or on the wards. ECGs, we do offer an open service for the country, so patients come to us from polyclinics, from their primary care practices, come straight to the cardiac unit to get electrocardiograms. But otherwise, most tests are have to be arranged through some clinic within the hospital or some facility within the hospital. Then on the invasive side, that would be our cath lab, where we do angiography. That's invasive angiography, where we look at the blood vessels supplying the muscle of the heart. And at that time, if an intervention needs to be done, we can do percutaneous coronary intervention, where we do angioplasty and stenting of a blood vessel. So what that means is we put balloons and wires and devices into the blood vessels to open up the blood vessel to relieve symptoms, to terminate a heart attack. We do pacemakers, we do other types of invasive testing in the cath lab in our invasive area. There's also obviously also the inpatient area, where also in our cardiac suite we sometimes admit patients with cardiac problems such as heart attacks. I guess the unfortunate thing about our cardiac suite is that we are not a full service unit as yet because of issues with staffing, but that is the hope in the future, that we will have a cardiac ICU up and running. And then, of course, we do a consultative service on the ward. So both us, the cardiologists, the cardiac surgeons, see patients in consultation from internal medicine department, from the pediatric department on as far as the pediatric cardiologist is concerned, and then the cardiac surgeons also admit to their service. So as you can understand, we have a very wide variety of services, and ends up being that we operate out of 3 separate areas within the hospital as well. So most of the time, the patients will interact with us, the public interacts with us in the cardiac unit, where we do all of our non-invasive testing and we do our clinics.
Dr. Scantlebury mentioned, the need for more staff, and I know there's a plan in progress, Mr. Harris. Maybe you can expand on that. The plans to improve cardiac care in the cardiac unit, and hopefully the ICU very soon, but also in terms of getting more of the specialists and the staff on board to ensure that we can cater to a demanding public.
Sure. Well, sometime back in 2018 or so, we started looking carefully at this and where we were going, and we look at what we expected the load and the demands would be, and we were able to convince the government to expand the staff in the area of cardiology. We know that this is going through the system at present, and but we are certainly promised an increased level of staffing that we would need to tackle the problems that we see coming, and so we are looking forward to that time, both in medical, nursing, and the technical areas, that we have the improved staff in numbers that will help us to really tackle the demand that the cardiac conditions are placing on us.
And in terms of the services, I'm thinking that we are far advanced than where we were back in the 1970s when we initially launched the cardiac care unit.
Well, I mean, theoretically, of course we are. We have now the ability to do advanced interventional cardiology with Dr. Scantlebury and her team. We have a vibrant cardiac surgical program that started back in 1994. Yes, 1994, and
is he right, Dr. Scantlebury?
Well, he's the one that started it.
Back in 1994, we were planning for it since 1993, so that's why there's a little bit of confusion there, and we are even looking to do fancy stuff of valve placement percutaneously and stuff. We have someone out training doing electrophysiology, and we expect that service to get going very shortly when she returns sometime next year. So we have expanded it, and we are really trying to keep up what is a modern cardiac service to the public of Barbados.
Now, with the help of the CapEx, once we get that, we should be able to enhance the services even further.
Yes, well, we always have to keep our equipment up to date and ensure that we are dealing with equipment that allow us to do what we intend. You will see, Shane, that what we have done though is ensure that we have very well trained personnel. Be that nursing, be that technical, and of course be that medical. Dr. Scanterbury and is a Mayo-trained clinic. I mean, that's as good as you can get in terms of cardiologists. We have our 2 cardiac surgeons are both United States trained. Dr. Smith with Downstate University and Dr. Powlett with Texas Heart Institute. So we have paid a lot of attention in making sure that we have the personnel to tackle the problems.
Okay. We have another caller on the line, but before we go to that caller, I mentioned CapEx, capital expenditure. That is the funding that we get to support the equipment upgrades and many of the services that we want to enhance at the Queen Elizabeth Hospital so that Barbadians have the best possible care at our tertiary health care facility. Let's go to the phone lines now. Good morning, caller. Welcome to the Pulse Radio Show. What's your question or comment? Oh, well, that caller disappeared. Hopefully we answered the question before he got to ask it, or he or she. And we welcome your calls. Those numbers again, 434-1007, 434-1070. And you can also send a WhatsApp at 434-1007. Dr. Scanterbury, this question goes to you and then to Mr. Harris. Where do you rank us in terms of the services we offer in the region and then internationally?
In the region, so there is just this huge variation in the capabilities of the countries across the region. So right now we have cardiologists, we have invasive and interventional cardiology and cardiac surgery. So we're really right up there as far as one of the major centers across the region. Out of all of the ones that I can think of, in Jamaica, in the north, Guyana, Trinidad, Suriname, those are the areas that have interventional cardiology. I know coming up at our meeting, our Caribbean Cardiac Society meeting, will be here in Barbados next week. And there will be cardiologists from across the country. I know there is a talk that will be given on setting up an interventional cath lab in the British Virgin Islands. But, some of the countries are at that area, at that point where they're now setting up cath labs. Out in St. Lucia and St. Vincent, they don't have invasive cardiology. I know St. Lucia has pacemakers, but they don't have a cath lab right now. And I've recently seen a couple patients from Grenada where there's not even a cardiologist at all on island. So, as I said, there's this wide variation in capabilities. What would be my dream is if we could have closer collaborations across the Caribbean where, say, in Grenada, they don't have cardiologists. Maybe it's easier for them to come across to Barbados or down to Trinidad to get care. But also, if we weren't so stretched, if we could go down and help them out. But that would require a lot of discussion. Another thing to think about is maybe having schools either for physicians or technical staff, maybe here in Barbados, where we could then make sure that the rest of the region is supplied as far as technical know-how. But as far as Barbados, we are up there as far as our capabilities.
Sounds like we are ahead of the curve, so to speak. Let's go to the phone lines very quickly before I let Mr. Harris give his take on where he sees Barbados in terms of leading in cardiology and cardiovascular care. Good morning, caller. Welcome to the Pulse Radio Show.
Yes, hi, good morning. Thank you for taking my call. How are you doing?
Very well. Very well. How are you?
Glad to hear that. Wonderful. Well, with great Parkland's great responsibility, you're responsible for this call. I have two questions, please. Good morning, Dr. Scanterbury. My question is for you, ma'am.
Mm-hmm.
Yes. No, you know that there's the cardiologist, the interventional cardiologist, and the cardiothoracic surgeon. My question is, why isn't it that because Barbados has one of the highest rates for cardiac disease in the world, we are a population that, as you mentioned correctly, doesn't exercise, and we need to really exercise more. So this is a two-part. This is the basically question one time.
Mm-hmm.
No, yes, thank you very much. Why is it that swimming, riding, and cycling isn't given more as a cardiac treatment or cure for the diagnosis of, and this is the other part of the question, the aspect of upgrading for more heart transplants or the other aspects of what has been dealt with in the new diseases that we would have dealt with long COVID, that would have been dealt with the heart of a lot of people who would have been affected by these terrible diseases that have been come for us over time. Just wanted to know that those two parts of that question, please. Thank you so much. Bye-bye.
Dr. Scanterbury?
What was the other thing he was saying?
Well, he broke it into two parts, but
yeah. So we talk a lot about walking, because walking is easy, but all cardiovascular type activities are important to help with reducing overall cardiovascular risk. So if you are someone that has knee arthritis but you can swim, by all means swim. That will help reduce your overall cardiovascular risk. Riding, again, if you can ride, go ahead and do so. You know, these are just different types of physical activity that can help improve your overall mental well-being, your overall physical well-being, improve your physical fitness, bring down your cholesterol and your blood pressure. The second part of the question, I'm not too clear.
Well, I'll try to ask it for him, because there's transplantation was mixed in there with COVID and the effects of COVID in terms of cardiac disease. Mr. Harris, you want to take that part?
Yeah, the issue of cardiac transplant is looked at it some time ago, and we did comparative studies, even with busy metropolitan areas like New York. If we extrapolate the number they're doing down to our population, we would probably be doing like one a year for the Barbados population, and that one a year comes by what would be available for in the donor area. We are now about to embark on having legislation that would allow us to harvest organs from people before their heart stop beating, the so-called brain dead legislation and those aspects. It will only work though if the Caribbean as a whole collaborate on that, and we have a full network of practice, and that is just surely to get the numbers up, because I think any center doing one heart transplant a year is never going to be viable, and it is never going to grow, and is never going to be able to sustain it, and it's never going to work. So I think that if we are going to be successful at doing heart transplants, it's going to have to be a regional effort, and we are going to have all the legislation in place that would allow that. So that takes care of that. But it is not something that we haven't thought about or haven't given some consideration to. It is just, it is really one of the strict limitations from our island state here, where our population is just never going to support an active program to make it something that we can pursue, unless we widen it, the wider Caribbean, where we can have 5 million plus people or more.
Did the onset of COVID increase issues, cardiac-related issues? I think that was a part of the questions.
I am not going to speculate on that because I don't think we have the
evidence,
firm data that would allow us to go one way or the other, and I think it is always going to be speculative on our part.
Okay, we have another caller on the line. Welcome to the Pulse Radio Show. What's your question or comment, caller?
I need to find out, y'all only dealing with cardiology or anything?
Anything to do with the Queen Elizabeth Hospital, but our focus is definitely cardiology.
I am a patient, and I want to find out how much longer it's going to take for people like me to have joints replaced.
Well, our joint replacement program was revived since early last year, and we've been doing a number of cases.
Right, and we did have some hiccup based on supply recently, but we seem to have been now overcoming that. So I hope that we will see a expansion, a big expansion in that. I know last week I think we did 3 cases or 4 cases. So we hope
I had mine done in 2007.
Right.
Mm-hmm.
And it is in a state I cannot walk. So I do not get no rest at night.
Right.
You know, when you ain't getting no rest, your body does deteriorate.
Yeah.
Of course.
Right, so I'm like that. So that's why I said I will call and ask the question, because this is over 4 years now that I've been just getting medication. Medication is not even working now, my dear.
I understand. What I would advise you, though, ma'am, is to have a serious discussion with your orthopedic surgeon.
I have done all of that.
You are attending the clinics regularly?
Yes.
All right. So I expect he will have good news for you when you talk with him in the near future.
I hope so. It should be September.
Well, let's hope that he has good news for you then. But yes, there is something that is of concern to us. It is one of those chronic diseases, joint arthritic problems, and we know that it needs to be tackled. And thank God we are in a state these days where we can do that. I remember joint replacements back in the past was this very airy-fairy condition, but now I think we see it as something that has to be a routine, because a lot of people, as we live longer and stuff, do get problems with their joints, and we really have to have that tackled, just like any other condition, to keep people independent, to keep them active, and to keep them from getting heart disease by being active.
Because I was in the netball, the long jump, the high jump.
Yes.
At 67, I can't do nothing. So
I know, you see, so you tortured your joints in your youth, which is good, but of course we now need to be able to keep you active so you can continue your healthy lifestyle.
Yeah, and if you need any assistance or any more information, you can always use that number that I gave the earlier caller for our help desk, for our patient advice and liaison service. That's 536 4800. 536 4800. You got it?
4800. I called you some time ago, Shem, but I didn't get you to you either.
Okay, well, my number is very easy to find. You got my number?
I got the number you just give me. I ain't got no other number for you.
Okay, you can call that and they will give you my number.
Okay, my dear. Have a great day, you guys.
You as well. And thanks for calling. Thank you very much for calling. Dr. Scantlebury, back to you. You have a number of events coming up. This is your month. This is Heart Month.
This is Heart Month. Yep.
So take us through some of these events that you have coming up. I think you start around the 24th of July.
Yeah. So on the 24th of July, so as I had mentioned before, the Caribbean Cardiac Society, of which I'm a member, is having our annual conference in Barbados this year. It usually rotates. So last year it was in Jamaica. This year it's our privilege to have it here in Barbados. It's a scientific conference. So from Thursday the 25th to the Sunday, cardiologists, cardiac surgeons, internists, GPs, nurses, all members of the healthcare team are going to be in the room talking about different things heart-related. But our outreach on behalf, from point of view of the CCS, Queen Elizabeth Hospital, Heart and Stroke Foundation, all of these different NGOs across the country who deal with the heart, we are all coming together to have a public event on the Wednesday, so that's the 24th. It's going to be focused on linkages between our culture and cardiovascular disease. So we're titling it Crop Over Culture and Cardiovascular Disease, linkages and solutions. In case you wonder what is the link between crop over and cardiovascular disease, it's just because crop over represents our culture. And like we were discussing earlier, part of our culture influences what we do, how we eat, how physically active we are. So we want to have these discussions, and we want to discuss what can we do actually on a macro scale, on a governmental scale, on a societal scale, to influence that culture to be a little bit healthier and to reduce our cardiovascular disease risk.
Yeah.
As far as the logistics of the program, we are going to be at standards distribution from 6 to 8 p.m. next Wednesday. That's a limited amount of people in the room, but it's going to be streamed on different channels. So QEH YouTube channel, Heart and Stroke, etc. So most of your attendance, if you're planning to attend, will probably be virtual, but if you want to come into the room and be there, because Heart and Stroke is going to do some health screenings at the beginning, you need to say it in the early, and you need to communicate with us in the early so you can have one of those very limited tickets to our event.
I would call it priceless seating, and I will tell of course, our listeners here on the Pulse Radio Show how they can do just that next Monday, how they can be a part of our public health talks. It's a part of our outreach during this 60th anniversary year. Dr. Scantlebury, I would really like to thank you for coming on the show and sharing with us today. Of course, the panelists will be Dr. Kenneth Connell, and you have some other friends joining you on the panel on that day?
Yep, Dr. Kenneth Connell, myself. We have spoken to Dr. Yannick Hume, who's head of the Department of Cultural Studies at the University of the West Indies, and then a representative, the president of the Caribbean Cardiac Society, Dr. Marlon Lawrence Wright, is who we have slated to represent the CCS. So I'll be representing QEH and the Heart and Stroke Foundation, of course. So I think we will have a great discussion. It's always great to have a chat with Dr. Connell, because we have a wealth of experience as far as cardiovascular disease, and it's our opportunity to talk to someone who understands culture and how culture impacts social determinants of health. So we want to come up with some solutions as well for our Barbadian society.
Yeah, we need those solutions. Again, thank you, Dr. Scantlebury. Thank you for spending the time with us. I know that you had to pencil out this time. You have a busy schedule ahead in dealing with the patients there at the hospital. But again, thank you for spending some time with us here on the Pulse Radio Show. You have a good rest of your day, even though it will be a busy one. Appreciate your time. Mr. Harris, any final thoughts in terms of how you would want Barbadians to respond to better heart health going forward, better cardiac care coming from the QEH?
Sure. Well, it's not just the coming from the QEH. I mean, you heard Dr. Dawn Scantlebury. She's also deeply involved in our main NGO for heart disease, the Heart and Stroke Foundation of Barbados. And I think we really do have to have those kind of cooperation from the NGOs. I think they play a very vital part in getting the information out to the people. But in all chronic diseases, it is about the lifestyle and the education of the public that is going to make a difference.
Indeed. I really want to thank you, our listeners here on the Pulse Radio Show, for spending the time with us. Of course, we're going to continue these conversations every Monday at 11 a.m. for an hour, spending this time with you, letting you know about our outreach from the QEH and how you can better utilize the services at your hospital. It is our hospital. On next week's program, I know I promised this this week, but we are coming with it next week for sure. It was his birthday today, so that's why we gave him a break. Dr. David Byer, happy birthday to you. He's the consultant and head of the emergency ambulance service. He'll be joining us along with Senior Ambulance Officer Trevor Bino for next week's edition as we focus on the emergency ambulance service and how it better serves you, the public. That's it for this edition, this episode, the 6th one of the Pulse Radio Show. Again, thank you to our sponsors, MedSafe Medical Supplies, and of course the Fit Stop. I'm Shane Seeley, joined by Mr. Anthony Harris, the Director of Medical Services. Please continue to enjoy the rest of your day and enjoy the rest of your time listening to Q100.7 FM.
Thank you so much, Shane. MedSafe Medical Supplies Limited. We have to thank them for sponsoring the QEH Pulse Radio Show, and they're there for all your medical supply needs. They offer a wide range of products, including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, they deliver free to the QEH. They're open Monday to Saturday, 8:30 a.m. to 5:30 p.m. You can call them at 624-7542. That's MedSafe Medical Supplies Limited, your trusted source for medical essentials.